One of the most misunderstood nutrients is vitamin A, and there are several surprising signs you or a family member may be dealing with a vitamin A deficiency. Now, I remember meeting Mary years ago, and she had been having issues with her memory and vision. She had joint pain, and she was frequently getting sick. I ran a comprehensive blood panel and found that her vitamin D levels were great. I was expecting a vitamin D deficiency, but she had been supplementing for a long time. But her vitamin A levels were far too low. As we began supporting her vitamin A levels, she began to feel significantly better. And you see, there's a key relationship between vitamin A and vitamin D, and supplementing with vitamin D while neglecting vitamin A could actually cause more problems. In this video, I'm going to break down what vitamin A is, what areas of the body it supports, and key signs and symptoms of a deficiency. I'll also go through the best strategies to support vitamin A levels and why carrots may not be the best way to support your vitamin A levels. So let's talk about it. What is vitamin A? Vitamin A is a fat-soluble vitamin and potent antioxidant that can reduce inflammation, oxidative damage, and free radicals. It's critical for vision and eye health, immune health, healthy skin, neurological health, bone health, circulation, and fertility. Vitamin A deficiency can lead to vision problems, immune system dysfunction, chronic inflammation, an increased risk of infections, illness, autoimmunity, neurodegenerative conditions like dementia and Alzheimer's, and even cancer. Fortunately, meeting your needs can be simple through a nutrient-dense diet and sometimes some supplementation, although not often. As an antioxidant, this key nutrient plays a critical role in fighting free radical damage and decreasing chronic inflammation in your body. Though we often refer to vitamin A as a singular nutrient, in reality, it's a group of fat-soluble compounds. These compounds include retinol, retinol, and retinol esters. Retinol and retinol esters can be found in foods, more specifically in animal products, including dairy, fish, and liver. Carotenoids, these are what we find in plant foods, including vegetables, fruits, and oils. They're kind of a preformed, or they're actually a precursor to vitamin A. Our body still needs to actually convert those. And once you consume those carotenoids, your body converts them into the active forms of vitamin A, which are retinol and retinoic acid. As a fat-soluble vitamin, vitamin A can be stored in your body to be used later. There's also risk for toxicity because of the storage of vitamin A. Most of it is stored in your liver in the form of retinol esters, which can be later broken down to the all-trans retinol to bind with retinol-binding protein and enter your bloodstream. Now let's talk about signs and symptoms of a vitamin A deficiency. We know it's critical for things like vision, skin health, proper bone growth, immune health, respiratory health, urinary health, digestive health, and more. And a deficiency in this key nutrient is a major health concern in lower income countries, especially in Africa and Southeast Asia. It's particularly risky for pregnant women and young children. You don't see it as much in America, but it can happen, particularly where people are eating a lot of processed foods, or even if they're supplementing with high amounts of vitamin D, that can actually end up leading to a vitamin A deficiency if they're not consuming enough vitamin A in their meals. Also, people with long-term malabsorption of fats, so if they have like pancreatic disorders, inflammatory bowel disease, celiac disease, leaky gut syndrome, gallstones, or trouble producing bile and other autoimmune conditions, these people are at a higher risk for developing a vitamin A deficiency. Deficiency in vitamin A can cause serious health issues, especially in children, including severe visual impairments, blindness, and a high risk of measles, infectious diarrhea, and other serious illnesses. Now, here are the most common signs and symptoms of vitamin A deficiency. Dryness in different areas, different kind of mucous membranes, like like lips, for example. Dryness in the eye, the conjunctiva and the cornea in the eye. Night blindness. Something called Bitot spots, which are caused by keratin that's building up on the conjunctiva in the eye. Scaly skin, thick skin, poor immune function, stunted growth in children. All these things can be affected by a vitamin A deficiency. Now, lab testing. There are two main blood tests I recommend for testing for vitamin A deficiency. One is really simple, very inexpensive. It's a serum vitamin A. You should get this. If you're going in, seeing a doctor, getting labs run, you should ask for a serum vitamin A on your blood work. And that's really easy. It measures retinol, the main form of vitamin A. Optimal vitamin A levels are between 45 and 70 units per deciliter, right? So you want to look at that. It should be between 45 and 70. It's not going to be flagged It could be like 25 and it won't be flagged. I believe the clinical range, they don't flag it unless it's under 20. So you want it higher than that. You want it between 45 and 70. Now you also want to get your vitamin D tested for a number of reasons. Vitamin D is critical for so many different functions in your body, but also there's an intimate relationship between vitamin A and vitamin D, and because they're connected and they work together. Calcitriol binds to VDR in the cell nucleus. Once that happens, the vitamin A receptor helps the activation of the vitamin D receptor targets. So you won't actually get the benefits of vitamin D unless you have sufficient amounts of vitamin A. High or low vitamin A can also suppress vitamin D levels, and it's good to look at both your 25-hydroxy vitamin D as well as the 1,25-hydroxy vitamin D. So typically your body will convert 1,25-hydroxy D into 25-hydroxy D. Normal levels, usually what's tested is a 25-hydroxy vitamin D. Normal levels of vitamin D are over 30 nanograms per milliliter. Otherwise, it's considered insufficient. And then if it's under 20, then it's considered deficient. However, in functional medicine, we want to see it really over 60 and possibly over 70 nanograms per milliliter, okay? And roughly 70 to 100 nanograms per milliliter. Now, let's talk about some of the benefits of vitamin A. It has many functions. One is it supports brain health. You see, vitamin A plays an important role in supporting your brain and influencing synaptic plasticity. That's one of the main benefits. And synaptic plasticity refers to your brain's ability to form and reorganize connections between neurons to allow memory and learning. Through its active metabolite, retinoic acid, vitamin A supports gene expressions that strengthen their synaptic connections. It's so critical for brain health. Vitamin A also supports neuronal survival, which can protect your brain from oxidative stress and neurodegeneration. It also supports neurogenesis in the hippocampus, which is part of your brain that's essential for both memory and emotional regulation. This is why the lady I was talking about in the beginning, Mary, she was having cognitive issues because she was vitamin A deficient. As we supported her vitamin A, she noticed she had better memory, better cognitive function. She was able to think sharper and quicker and just felt more relaxed in her brain. And that was so key. So vitamin A also really important for eye health and vision. Okay, and this is potentially the most well-known benefit. Most people, when they think about vitamin A, think about eye health. It is important because it helps your eyes and the vision because it's a component of the rhodopsin molecule. And that molecule gets activated anytime light shines on your retina. It sends a message to your brain to activate vision. Beta carotene, which is converted in the body to vitamin A. Beta carotene is what we get from carrots, for example, and sweet potatoes and things like that. It gets converted into retinol, vitamin A, and it plays a critical role in reducing the risk of macular degeneration, which is among the leading causes of age-related blindness. Now, vitamin A also supports skin health and tissue healing, and it's extremely beneficial there. Dermatologists commonly recommend it for acne, fine lines, and wrinkles. And a 2024 study published in Skin Health and Disease showed that retinol helped to reduce wrinkles and fine lines, and they were putting it on topically. Now, consuming foods rich in fat-soluble retinol as well as beta-carotene are also helpful for eczema, psoriasis, and other skin conditions. Moreover, vitamin A is also effective for tissue repair and cellular regeneration, which may help improve wound healing and tissue healing. Now, vitamin A is also important for your immune system, and it helps calm inflammation. And that's one of the major roles that it has in the immune system. It helps to reduce the risk of infections and illness. According to a 2022 review, a deficiency in vitamin A can lead to poor immune cell function, weaker immunity, and related increased risk of health issues, including allergic issues, infectious diseases, histamine issues, inflammatory conditions, and even cancer. Now, it also helps heal leaky gut, and this really plays into how it works at reducing inflammation as well, because vitamin A is key for maintaining a healthy gut lining. You see, the gut lining has small openings that allow nutrients to enter the bloodstream. The openings should be small. Otherwise, if the gut is damaged and those openings are large, now we have toxins, pathogens, and undigested food particles that seep into the bloodstream. That increases the risk of chronic inflammation, gut health issues, and autoimmunity. Both vitamin A and vitamin D play a role in intestinal epithelium and mucosal immune system regulation. You see, the mucosa on the intestines. It's produced by the goblet cells. That's your first line of defense in your gut, right? It helps, it's where the immune component of your gut is, something called secretory IgA, helps protect against infectious microbes from building up. It helps protect against toxins from seeping into the bloodstream. And deficiencies in vitamin A as well as vitamin D increase the risk of leaky gut syndrome and toxins getting into the bloodstream, driving inflammation. Vitamin A helps to regulate the growth and differentiation of the epithelial cells in your intestines. It allows the production of that mucin that I was talking about, that protective layer that strengthens gut barriers and allows for better digestion. Also, if you want to have children, well, vitamin A supports fertility, pregnancy, and fetal development. It's great vitamin for supporting reproductive health, right? It plays a role in hormone regulation and reproductive organ function in both men and women. It helps ovulation. It also prepares the uterine lining for implantation in women. So really critical for fertility for women, but it also helps with normal sperm production in men. During pregnancy, it's important for placental development, maternal tissue growth, and the formation of the fetus's organs, including the eyes, lungs, heart, and immune system. So if you want to have a healthy baby, make sure you get enough vitamin A on board. Also, if you want to have healthy bones, you got to have vitamin A. It's essential for the activity of osteoblasts and osteoclasts, which are the cells necessary for making and remodeling bone tissue and creating strong, resilient bones. In children, vitamin A is critical for skeletal development and bone elongation. In adults, it's necessary for bone density and bone repair processes. And also, vitamin A helps support healthy circulation and overall cardiovascular function. It's important for the growth and repair of the endothelial lining of your blood vessels, which keeps them flexible and strong and keeps your blood pressure under control and allows you to have good circulation. So you have proper blood flow to tissues and organs. That supports your energy, your endurance, and healing. A vitamin A deficiency can increase the risk of weakened vessel integrity. That impairs oxygen delivery and it gives you a greater susceptibility to circulatory problems as well as heart disease. Also, vitamin A is really critical for good thyroid function. Vitamin A helps with thyroid hormone regulation, and that is critical for fat burning and metabolic rate. So we really need good vitamin A levels in order to have proper thyroid function and proper fat burning. Finally, vitamin A is really key for measles. You know, we know of measles as a childhood infectious illness, and measles can significantly deplete the body's vitamin A stores. That can critically weaken the immune system and increase the risk of severe complications from measles, including diarrhea, vision problems, blindness, and pneumonia. There was a 2020 research that was published in Infectious Diseases and Clinical Practice. So this study looked at supplementing with vitamin A during measles infection and showed that it reduced the severity and duration of the symptoms, it lowered the risk of complications, and it decreased child mortality rates. The World Health Organization recommended high-dose vitamin A supplementation for children diagnosed with measles to support immune function, protect vision, and promote faster recovery. So the recommended oral dose by the World Health Organization is 200,000 international units for children. Now that's equivalent to 60,000 micrograms. As you'll see when I break it down, that's a really high dose. And also 100,000 international units in infants, which is roughly 30,000 micrograms of vitamin A. You only do that for 2 days, right? So 2 days for children, 2 days for infants. Has a remarkable effect on measles. So if you've got young children, have some liquid vitamin A around. That can be really helpful for treating measles. Now, vitamin A is also a topical treatment of skin warts. And it's been used by a lot of people and been really effective for treating skin warts, including those from HPV infections, which can result in abnormal skin cell growth. According to a case study of a female patient with serious skin warts that resisted even things like salicylic acid, apple cider vinegar, and over-the-counter essential oils, the topical vitamin A turned out to be an effective solution. So what they used here was a daily topical application of 25,000 international units of vitamin A that was derived from cod liver oil. Her smaller warts disappeared within 70 days, while one larger wart took 6 months to heal. That larger wart was 9 millimeters, right? This is pretty big. It took 6 months, but it healed. So if you're dealing with a serious and stubborn case of skin warts, topical vitamin A may be your best bet. It tends to work even when other kind of quote unquote natural or traditional approaches to skin warts don't work. But make sure to buy a high quality, hypoallergenic, and highly concentrated vitamin A brand for optimal results and safety. I'll have a link in the show notes if you're looking for that. These benefits from vitamin A come from its ability to increase healthy cell turnover and normalize keratinization, which can make it more difficult for the virus to thrive. Vitamin A topicals, especially with retinoids, may help to lower viral activity and reduce the size of the warts. However, topical treatments may cause problems in sensitive individuals. So always important to start slow. Start with a lower dose and then, just see how you have to adjust it based on how your body responds. Most people do well, but sometimes people are a little bit sensitive. Now, let's talk about food sources of vitamin A. The RDA, recommended daily allowance for vitamin A, is 900 micrograms for adults and 300 to 600 micrograms for children. Remember, we were talking about doses for measles of 30,000 micrograms, right? And 60,000 micrograms. Huge doses, right, for measles. But that was only for 2 days, 2-day period, right? Again, the RDA is 900 micrograms and 300 to 600 micrograms for children, and an extra 500 to 600 micrograms for pregnancy and nursing. Now, RDA is kind of like the minimal baseline, so you don't have a deficiency. Most functional nutrition experts recommend at least 1,500 to 2,000 micrograms of vitamin A daily from food. That's what I recommend, somewhere in that range. An upper limit for vitamin A would be 3,000 micrograms daily, although many people have consumed more than that from foods without reaching toxicity levels. I consume typically around 5,000 micrograms daily with food and supplements and have optimal levels when I test. So I'm not as worried about toxicity levels. Usually if we're testing regularly, we can see if you're creeping up in that range. The best way to improve your vitamin A levels is through a nutrient-dense diet that's high in vitamin A-rich foods. Let's look at some of the best foods, and remember that fat-soluble vitamin A is the most bioavailable form of retinol. That's what we find in liver, egg yolk, and cod liver oil. So the animal-based fat-soluble vitamin A is the best form, but we also do want to get carotenoids and other antioxidants that are in the vitamin A family from plant-based foods. So beef liver is for sure the richest source of vitamin A. 3 ounces of cooked boiled beef liver has about 17,800 micrograms, which is almost 2,000% of your recommended daily value, right? So very high dose. If you're doing liver on a regular basis, you're getting plenty of vitamin A. Cod liver oil. 1 tablespoon of cod liver oil has about 4,000 micrograms, which is roughly 450% of the daily value of vitamin A. Liver sausage, obviously it's made from liver. We already know liver has a lot. So about a 1/4 cup of liver sausage has about, or liverwurst spread, which a lot of people use, has about 2250 micrograms of vitamin A. That's roughly 250% of the daily value. A sweet potato, this is gonna be, basically your best plant food. 1 medium cooked boiled sweet potato without the skin has almost about 1,200 micrograms of vitamin A, roughly 132 to 135% of the daily value. Butternut squash, also a good source. 1 cup of baked cooked butternut squash or winter squash has roughly about 1,140 micrograms of vitamin A. It's roughly 126% of the daily value. Spinach, 1 cup of cooked, boiled, drained spinach without salt has roughly 943 micrograms of vitamin A. That's roughly 105% of the daily value. You got bluefin tuna, 3 ounces of that has roughly 643 micrograms of vitamin A, 71% of your daily value. A carrot, we talked about carrots. 1 medium raw carrot has 509 micrograms of vitamin A. It's 56% of the daily value. So good source, but didn't make the top 5 sources. Cantaloupe, 1 cup of raw cantaloupe cubes. It's orange, right? These orange foods, sweet potato, butternut squash, carrots, cantaloupe, they have these carotenoid antioxidants. So cantaloupe has about 270 micrograms of vitamin A. It's roughly 30%. Red peppers, 1 cup of red peppers has 234 micrograms of vitamin A, roughly 26%. And then eggs, one of my favorite sources, 2 scrambled large whole eggs have around 98 micrograms of vitamin A. Now, if you get pasture-raised eggs, that can go up to 150, even 200 micrograms, or roughly around 75 to 100 micrograms of vitamin A in a pasture-raised egg, okay? So that's gonna give you a lot higher dose, and that's one of my favorite ways to get vitamin A. Other good foods include kale, lettuce, broccoli, dairy. So grass-fed butter, for example, is a good source of vitamin A. Mackerel, salmon, other fish, papaya, mango. So any of the yellow, orange types of fruit, other than banana. Banana really doesn't have any, that's more of a white fruit. But the yellowish or orangey fruits like papaya, mango, they're gonna have vitamin A in that. Now supplements, guys, you rarely need supplements for long-term health, but they can be helpful, especially for those who are supplementing with vitamin D, but you don't need much. Fat-soluble retinol is in its best form. We can find that in organ meat supplements. So if you're getting like a beef organ complex or a beef liver complex or a cod liver oil, which is a great way to get omega-3 fats, you can find good preformed vitamin A in there. Also, multivitamins and immune support supplements. Many of them have some vitamin A, and you want to look for it like in a multivitamin or an immune support supplement. It should be in the retinol palmitate form or as mixed carotenoids. Those are good forms to use. But again, rarely do you need extra via supplementation. I take supplements that have small doses of it, but typically if you're eating a nutrient-dense diet, getting those orangey foods, getting organ meats into your diet, eggs, grass-fed butter, eating wild-caught fish, things like that, you're gonna get sufficient amounts in your diet. And with Mary, I had her eat a sweet potato every day, and I also had her implement a little bit of liver, right? And so I put her on a beef organ complex supplement because she didn't like the taste of liver. So she did that, and she loves sweet potatoes, so I just told her just have a small sweet potato every single day. She did that. Within a month, she was feeling significantly better. I mean, really within weeks, right? And by the time we tested her again, her vitamin A levels were great, and she had optimal vitamin A and vitamin D levels, and her health was significantly improved. So make sure you're optimizing your vitamin A levels as well, and we'll see you in a future video training. Be blessed.